We were previously on a system that was housed in the office on a server. And we couldn't go any farther with that product. It would not give us the reporting that we needed, nor adjustments that we needed to do on patient accounts correctly. We wanted to go with a web-based system where you could take it and work anywhere with it and bring it up and house it off-site so that things would be safer. The easiness of claims going out, the precision of money coming back in, the quickness of how our claims are being translated from the office to the vendor to the payer itself. Well, I think the fact that you have the tutorials on there. If I cannot figure something out or I need help with something, it allows me to go and educate myself further. The quickness of how things are to post, I mean, it's just phenomenal. It doesn't take long to do much of anything. Doing the ERA and taking the insurance checks and putting them on accounts, it's like half my day. It doesn't take me as long. It's not an all-day process like it used to be. Being able to make several appointments for one patient if they need to come back several times. Just the system itself is great. When you start a new product, you have a trainer. You know, in any product you have trainers. But this allows you to go a little bit more in depth. And it gives you the ability to redo things and reassess what you're doing and making sure that you're doing it correctly. And on an educational point, I really like that part of it. Well, I have a small office, so they're able to accommodate a lot more than what they used to be able to. It's easier for them to put information in and get it correctly added. It's easier for them to verify insurances. Before, they used to have to sit on the phone a lot. The fact that you can see a lot farther down the road with your system to see what's happening within your office. And pretty much just on day in and day out, things get done a little bit quicker than what they were before. Well, after the first 30 days of actually starting to bill on AdvancedMD, I noticed quickly how money was coming back. We do some that are EFT into our account and then some that are check-based. And I was amazed at how quickly the payers paid us by the time, within the time frame. Usually the other time it would take 25 days or longer to be paid on some of them that should have been like a turnaround of 15 days. And I'm noticing now it's like a 15-day window, just using AdvancedMD. I realize that most practice managers do not do the billing in their office. They do other tasks that are there, and that they usually hire a biller to do them. But because I do all of that, I find that this product is AdvancedMD is a very time-saving piece of equipment because it allows you, once you get everything established and done in it, it allows your time to be outsourced better. You can get it done, it's efficient, and I know it's only as efficient as the user, but it gives you that quality that you need to be efficient with what you're doing. It's a great product as far as growth goes. It gives you information that you don't normally get with other systems. The tech support is wonderful. I mean, when you have a question and you can't research it and you've done all you can, they are there to help you. It's nice because it's based out of house, so you don't have to worry about a fire or somebody coming in and stealing your equipment and all of the patient HIPAA laws that you have to deal with. It's nice to have it somewhere else and safely being guarded. The speed is great, and I would recommend it to anyone.